identifying key risk factors of GERD in patients with diabetes. Diabetes is a very common illness in our country. Roughly 12 to 15% of the population is suffering from diabetes. Almost equal number of persons are having diabetes, but they are not knowing it. So this number is very huge in our country. And people have said that India would be a diabetic capital in the coming years. Now, diabetes is a condition where there is an increase in the level of sugar in the blood, also known as hyperglycemia. Insulin is a hormone that helps turn sugar into energy for the body in this condition. Insulin acts as a key and which helps in transporting glucose into the cells. The insulin is produced in the pancreas, in the beta cells of the pancreas, and this is an organ which is located in the abdomen. Diabetes, the cause of diabetes, either the insulin is not produced in the enough quantity, or the production of insulin is altogether completely stopped. Or there is another pathology that the action of insulin, there is resistance in the body, which is also known as insulin resistance. The high risk of GERD in people with diabetes is often linked to how long they are having this disease, diabetes. And this increased risk is due to nerve damage because of autonomic neuropathy and stomach tissue because of diabetic gastropathology. The main reason is diabetic autonomic neuropathy, which leads to stomach. And this risk is because of the nerve damage because of neuropathy. As a result, people with diabetes have a weakened muscle of the bottom of the food pipe, that is esophagus, lower esophagus, and problem with the movement of the food to the stomach, which is because of gastric dysmotility, which lead to GERD as compared to those who do not have diabetes. Another factor is late diagnosis of diabetes, which is very common in our country. Most of the patients are diagnosed with diabetes very late, due to which in some cases the disease may progress fast and lead to nerve damage and disease related to the stomach, that is gastropathology. The diabetes itself is a risk factor in the treatment of GERD because it reduces the effectiveness of acid suppressing medicines, that is either PPI or S2 blockers. And PPI are the main therapies for GERD and also the risk of developing disease such as bad esophagus and esophageal. Consumption of foods that are high in fat or spices and drinks, particularly cola drinks, that can cause disturbance in the stomach, such as coffee and tea, also increase the risk of GERD in diabetes. So one should limit the consumption of these cola drinks, tea and coffee in patients of diabetes. The best way to manage the risk of developing GERD in diabetes is early diagnosis of diabetes and effective treatment of GERD in diabetes because the symptoms can be unusual or even absent, and the symptoms can be confusing. Ideally, GERD should be diagnosed as soon as possible to manage it properly. It is advised to do routine checkup and maintain sugar levels within the normal range if you have diabetes to prevent or reduce the symptoms of GERD. One should have early suspicion for this disease, that is GERD. If a patient gets up in the night and starts coughing, one should suspect that the patient may have GERD. Or it triggers the attack of bronchial asthma in a stable patient in the night time, one can suspect that probably the patient may be having GERD because the aspiration of reflux, gastric reflux of gastric juice into the trachea can lead to coughing and a start of bronchial asthma attacks. So one should be very cautious about it, that it can be one of the causes for initiation of bronchial asthma attacks. So that is what I wish to say in this small lecture or deliberation, that one should suspect GERD at early age. Use of PPIs for 4 to 6 weeks is very effective in controlling the symptoms of GERD. Raising of the head end is very effective. Diminution of alcohol or reduction of consumption of cola drinks, spicy food, fresh and fried food is also helpful in controlling the symptoms of GERD. That's all.